Welcome to Sustaining Collaborative Impact. My name is Casey Deems, and I'll be running today's web forum along with my colleague, Jeff Bornstein. Today's web forum is sponsored by the Leadership Academy for the Public's Health, a program of the PHI Center for Health Leadership and Impact, and produced by Dialogue for Health. Now it's time to meet the moderator of today's event, Dr. Carmen Rita Nevares. Dr. Nevares is the Senior Vice President Emeritus, External Relations and Preventive Medicine at the Public Health Institute, a senior executive position she held from 1998 to 2021. Dr. Nevares is also the co-director of the PHI Center for Health Leadership and Impact and the co-director of Dialogue for Health. Welcome, Carmen.
Yes, good morning, everybody. And thank you, Casey, for the intro. It's really a pleasure to start on this topic today. There is so much need for a really good conversation about how to think about how we stay sustainable. So I really want to get this going and want to hear from you as an audience. So I want to ask everyone, should you have questions or comments, please put them in the Q&A, and that way we can incorporate what you're thinking into the way that we address this really important topic. Can I have the next slide, please? So this session is being brought to you by the Center for Health Leadership and Impact. We are about building healthy, equitable communities for sustaining and creating impact at scale. We do this through strategies, partnerships, coalitions, action, and data. Next slide, please. It is a huge honor for me to introduce Dr. Karen Smith, who's the former California State Public Health Director and Health Officer appointed by then Governor Jerry Brown in 2015. While in that position, she led the cross-sector and innovative approaches to population and community health improvement that were required to address the complexity of issues such as the opioid crisis, statewide preparedness and response, and communicable disease control. During her career as a public health public servant, she's learned about the critical importance of collaborative work while leading America's largest state's public health agenda. She's a founding partner of Healthy Community Partners, Inc., a consulting collaborative that integrates strategic design thinking with innovative financial strategies to help communities create equity-building, sustainable health initiatives that empower their residents, adapt to their changing needs, and enable capital investment. So with that, I'm welcoming Dr. Karen Smith.
Good morning, Carmen, and good morning, everybody in the audience. It's really exciting to see such a wide swath of folks, and I'd especially love to say hello to the 4% of you who are in the private sector, because that's a sector we don't talk to nearly enough. Having spent my entire career in government, I'm acutely aware of what a government can and can't do. And I think working with the private sector is one of the areas where we need to do more of that, we being those of us in government, although I'm no longer there. So what I want to do to start with, Carmen, if this is okay with you, I want to talk about what, and when I say we, I'm talking about the partners that I work with in Healthy Community Partners, but I think you'll all recognize most of this. But there are some foundational things, capacities and capabilities that I think that multi-sector collaboratives need to have. And so I want to, before you can really truly find ways to become sustainable over the long term. So I'm going to talk first about those. But the very first thing I want to say is that the whole reason I'm doing this work now is I'm incredibly excited about the potential that multi-sector collaboratives have to create true systems change in communities. In particular, in giving power back to communities to identify the priorities and help craft the strategies that'll be used to address those priorities over time. Centering community voice like that and recognizing community priorities, having all the relevant parties at the table is really important to success in that regard. But these kind of collaboratives are also a little bit vulnerable to certain sorts of threats. When it's a lot of well-meaning people coming together, you can do amazing things. But what happens if you had the charismatic leader who came in and sort of jazzed everyone up and got you started, leaves? I've seen collaboratives sort of stutter and even dissolve after that. Also, most collaboratives have some sort of anchor organization, one that's helping to actually run the collaborative. Well, those organizations may also have changes. They may not be able to donate the time of their staff anymore. The best example of that are changes that can happen if a governmental partner is one of your anchors. For example, in California, we have the California Accountable Communities for Health Initiative, which is a network of multi-sector collaboratives. But for many of them, the public health department is their anchor organization. Well, you can imagine what happened then when COVID came. There was no one in public health who had time to sort of at that point kind of be still continuing to organize and run a collaborative. So government does have its restrictions and it has its budgetary issues. And so having a single organization that is donating their time or willing to actually do the organization does have risk. There can also be really big changes in donor funding or available grants that can represent a vulnerability for the multi-sector collaborative if it changes. And sometimes that occurs in reaction to, for example, large political shifts, which we've seen many of recently. There are 5 things that we think are, if you have these capacities and these capabilities in your multi-sector collaborative, you're really ready to launch. You're really ready to get out there and get some money and some resources that can help you sustain over time and not just help you build healthy and resilient communities, but to yourself as a multi-sector collaborative to be sustainable and resilient. So let's go to the next slide. I'm going to walk through these. I'm not going to take a whole lot of time because I want to have a conversation. And so we're going to talk about, I think, the things that are most important. One of the most important is integrating the next 4 things I'm going to talk about: administration, governance, data and IT, and raising money, capital. Those don't work well if they're not integrated. And so integration is key to having it work. So let's talk a little bit about administration. This is probably the most foundational capability that is required to actually just keep a collaborative working and meeting. And it takes time, it takes energy. And you can, of course, do this by partnership, by informal alignment, by volunteerism. But again, that becomes difficult as your collaborative grows if you decide that you're going to have more types of interventions in different areas, and now you have different kinds of grants. That can become very complicated. And if you have one entity that is your anchor organization, like a public health department or like one of your leading nonprofit organizations, there's a risk too that entity becomes the automatic leader and has the strongest voice. And that's not always how a success occurs in a multi-sector collaborative. Everybody's voice has to be heard and valued. Also, staffing may change. The person who was doing this administrative work for you may leave. Who's going to do it now? And as your priorities change, then the types of administrative activity may change as well. And in particular, as I alluded to, government entities as your anchor have real risks because we are all in government is restricted by the funding that's available and the staff having that funding. And you have no control as the collaborative over who that is and how what happens to those individuals because they belong to a different organization. Let's go to the next slide, please. And related to administration, but distinctly different, is governance. This is the question. This speaks to how does your collaborative actually function? And that strong governance structure is really essential if you're all going to trust each other. So who's at the table, including community? How are you going to make decisions? How are you going to set your priorities? And how do you figure out if you're staying on track? Those are not things that you can do without thinking about the processes first if you really want to sustain. You can't sort of head out. Everybody is there. You're all excited. The work is going great. You make some real progress. You want to move to the next step. Without going through a formal process to develop your governance structure, it can become chaotic very quickly. And what's more, you can end up having different members of your organization in conflict with each other. And that's especially true when you're doing things like prioritization. It's very important to have had these conversations ahead of time. Let's go to the next one. Partnerships. Now, this is obvious. We're talking about true multi-sector partnerships. These are actually, I think, really inherently the strongest type of partnership. But sometimes the way we start out is with what I call the usual suspects. And for those of us my entire career has been in governmental public health, that usually means the nonprofit organizations that we work with and their partners, where most of what ends up happening is most of the people at the table are the people who are working in the health and human services fields, which is wonderful and absolutely essential. After all, we are trying to build healthy communities. But everyone who knows public health knows that it's not just a particular part of public health, but it is really the way communities are structured, the way communities work, the resources available. It's those non-health, non-directly health-related social factors that impact health and impact the resilience of a community. And so that's where we need those diverse partnerships. We need to have the private sector at the table. If you're really interested in working on health issues specific, you've got to have the health system at the table. And the health system's complicated. It's a lot of different entities. So figuring out how you get the right people at the table and keep them there. It's really important that's where the governance structure and the fact that you've got administrative support, it makes you a really strong partner. Then bringing those partners together have a lot of advantages to your collaborative. If you have well-respected partners at the table, your collaborative has credibility. That's really important, particularly as you start to ask people to change what they're doing, to work with you, to fund you. All of that requires that they respect who you are, they recognize who you are. And also having those multi-sector partners can really create complementary skill sets, for example, and that allows your organization to think more broadly about what kinds of things you're going to do. And you don't have to have every single entity at the table at the very beginning, but bringing in partners as your organization grows and matures is a really important thing to do. Having community leaders in your collaborative is really important, because you're ultimately wanting to work with the community, with the people who live in that community, and seeing their leaders at the table, having a voice, speaking on behalf of the collaborative is really important. And the fact that you have multiple sectors working together can actually really help you ensure that your focus remains on the core of the collaborative itself. People are less likely to be sort of speaking to their own organizational or sector priorities, but keeping that focus on the core mission becomes everybody's job. Let's go to the next step. All right, so I would actually probably call this measurement, information and technology. This is one of the areas where, at least in the collaboratives that I've worked with in California, have a struggle, because instantly you think information technology, oh my God, we have to have an IT system. We don't have that. We don't have the money for that. This is a really challenging area, but there are many different ways that you can get information and you can measure things. And so as you mature, this is something that as a collaborative matures, being able to say, we have a consistent method to both measure our progress and also demonstrate impact is critically important. You can have multiple modes of coordination through information sharing and workflow management. That goes a long way to gathering the information that you need. But consistent data collection, validation, analysis, and your guides for decision making and taking action, which we talked a little bit about in governance, are actually critically important for a couple of reasons. One, you're demonstrating progress and success, and you're identifying places where you're having challenges so you can work on those things. And then ultimately, in the long term, having this kind of information on your results, your outcomes, and difficult but really important impact in the community is that you can generate then information that can trigger sponsors, that can get investors interested, and can bring new partners to the table. So you don't necessarily have to have, $500,000 to build a massive data system, because how you gather data and what data you gather is going to differ a little bit from intervention to intervention. But I am a huge believer in, as you design a program, an intervention, you should be at the same time figuring out how you are going to measure your progress and your ultimate outcomes. Because if you don't, it's really hard to backtrack. So giving that some serious consideration at the very beginning actually really helps. Okay, next slide. Yes, capital. Okay, this is the piece everybody always wants to talk about. So that's actually why I left it until the end, because I wanted to make the point that fundraising, even grant making, in order to get money, whoever is putting that money out needs to know that you have a strong organization and that you have the capacity and the capability, two different things, to actually carry out the work that they are funding you for. And that's true if it is a very specific intervention that you're getting a grant for, or a pay for performance kind of intervention. But it's equally true if you're looking to build what we call a resilience fund. The secret to long-term sustainability is having money, having resources that will allow you to actually do the work that your collaborative wants to do and that the community needs and wants you to do. It's important that you know where your money's going and be able to report that back. Now, let me say, we can talk later a little bit more about how you do things like build your a fund and that, but you don't have to have all these capabilities necessarily in-house. There are many really successful organizations that function with a fiscal agent, for example, that takes care of some of that work. But as an organization, as a collaborative, it's important that you be able to demonstrate your capability in this area. And this particular area of capital and fundraising is one of the reasons that I personally support a collaborative at some point in its maturation, when you're starting to really think about sustainability and long-term funding, to actually become an organization, a formal organization of some sort. And there are many different kinds of those. But being a 501c3, for example, or being some other sort of formal organization gives funders confidence that you actually have the capabilities that you need. And you can see here, you really do have to understand, and oh, very important disclaimer, this is not my area of expertise by any means. That's one of the reasons I worked in government, was because I never wanted to run an organization that had to manage money, because I can barely handle managing my own personal money. But I do have tremendous respect for the importance of these things. And you don't necessarily know how to do that. There are plenty of consultants out there. There are a lot of different ways to do this. But I want you to know that at some point in your maturation process, you're going to want to stop running from grant to grant. You're going to want to start doing more things. And that requires a certain amount of financial capability. Understanding what your cash flow is and how that's working, determining, if you're getting different kinds of funding, you may have certain sorts of outcomes that you have to present that are financial. You may have non-financial types of returns that you need to have. Managing organizational complexity which is going to happen if you're successful. This is a really important area. But the 4 things that we talked about before and the integration are key to being even able to do this. And so I'm going to stop there, and Carmen, go back to you, and maybe we can have a conversation.
This is truly great way to set up a conversation about what does the bedrock need to look like? What are the basic functional components that an intersectoral group, a cross-sector group, needs to have in order to just get off the ground? So I'm going to ask you, and please, audience, send in your questions, Q&A. We will do our best to make sure we're thoroughly answering them. But let's just start off by going back to the administrative box for a moment. And let's talk for a minute about what kind of models are out there. When you say administrative, the administrative component, what do you encourage people to do, and what are some different ways of doing that? Give us a couple of examples, just to be real concrete for a minute.
Sure. So there's a couple of, one important factor is how mature is your collaborative? I mean, are you just getting together? When you're just getting together, leadership is key. Okay, you need leaders. You need to gather information about your partners, because how do you reach them? Who's the actual designee? That's all administrative stuff. Like who's been at the table, who, etc. And then there is, quite frankly, the run-of-the-mill setting up a meeting, keeping minutes, distributing the minutes, all that kind of work. Typically, most the collaboratives that I've seen, that starts out being some sort of anchor institution. In the world of accountable communities for health, we tend to use this term backbone. There's a backbone organization, but often that backbone organization, especially at the beginning, is either a governmental entity. I've seen obviously public health being creating collaboratives and bringing people together, because that's a big part of how we work in public health, just to begin with. But I've seen other collaboratives where it might be it's often a governmental entity, because there's you usually have staff who have within their responsibility this kind of getting input from stakeholders and that sort of thing. But again, then that model works best if that entity that's being that backbone, whether it's a governmental entity or a given nonprofit who really wants to make this work, they have a very loud voice, especially in the beginning when there is no real governance structure in place. And that's something that it's really important that you have these really excited and motivated leaders in the beginning. But behind the leaders, you really need to just keep the train on the track. And that's what we mean by administration, all the things that go to creating that. And when you're just beginning, and if the entity that is is providing that leadership has the funding for someone to do that, that person also often doubles as the administrator. And that means they maintain the distribution list and that sort of thing. But as you start to increase your portfolio in the community, even if it's something like sending out newsletters or having a website, now you may be getting beyond the capacity of a single organization, especially if what you want to create is a true collaborative. And a true collaborative means everybody's at the table, everybody has an equal voice. And when you start bringing community in, you're asking people for whom this is not their job to join you voluntarily. That you need to respect that, but you also need to be able to support that. And that means you do need to have some level of administration. Those people need to know, and quite frankly, in my opinion, community members who are donating their time need to get something back from that, whether that's a stipend covering their expenses, et cetera. It's different when you work for an organization, you're an employee, this is part of your job duty. When you're a community person and you're giving up your time, we need to be really respectful of that. So the primary model I see early on tends to be a single organization is the base, they take on the administrative work. If you start building a portfolio, and then there's the grants, right? So if you want to go and get a grant, somebody has to do that. And somebody, it has to be somebody who can actually legitimately apply for that grant. So there are grants to public health departments that it wouldn't matter who was your leadership for the organization. It's the public health department that has to go after that grant. Same thing for almost any governmental grant. It tends to be, unless it says a nonprofit organization. Well, you need to have nonprofit organizations willing to do that work, unless you have developed an administrative structure that shares out that work. That requires money. Okay, so I mean, this is why in the beginning it's kind of a volunteer effort. Everybody kind of pitches in with whatever pieces they can do. But to become real, and especially to become real and sustainable, you have to figure out as an organization, how are you going to do that? And an unfortunate reality of the world that we all work in and live in is that nobody wants to fund the backbone. Everybody wants to fund the interventions, right? But nobody wants to fund the backbone. The other advantage to having a formal organizational structure, which is typically the next step that people take, is that structure, it has to be funded somehow. And it's the models that I've seen for that in the early stages tend to be each of the, if there are players at the table, like a health plan, for example, or a large nonprofit with many funding streams, there, or your collaborative has applied for funding for an intervention. There's always overhead that has to be built in. That overhead, rather than going to the entity that did the direct application, could be split with the organization itself that's the collaborative. Does that answer your question?
What I really like about this is you're doing a really good job of giving people a solid sense of what that backbone organization needs to look like in order to come in and start the business of looking for real money. And I want to not go away from that just yet. I have one more question. We're getting really good questions from the audience. But the other question that I had for you has to do with the governance topic. Talk a little bit about what how explicit you think a good governance process needs to be in order for a funding organization to look at a collaborative and say, these people are a good investment.
Yeah, that's a really important point. And this is actually the area that I work on most in our own collaborative is governance structure, because I've seen chaos reign if you don't have these conversations early. And I will tell you, and this doesn't sound like it's part of governance, but I think it's one of the most important things you can do early in a collaborative. When you get everybody at the table, we almost never explicitly ask people, why are you here? right? What you personally and your organization. And that's important because everybody, you come, when you come together, this, I all my whole career, I did this, and I never, until somebody told me how important it is to have these conversations early, I never did. You come together with like-minded people and you're all very excited and you all really want to be there. But when you're representing sectors or organizations within a sector or governmental entities, it's really important for everyone to say, what do they want to get out of this, out of being part of this organization? And what does their organization, if they're there as a representative, want to get out of this? What are your restrictions? So for example, I've been in plenty of collaboratives where I didn't have the ability to commit my organization to anything because I worked for the government. So having those things laid out on the table, you know, and also a little bit about the person themselves. Why are you here? If the answer is I was assigned, that's fine, but it also tells you something about that individual. And it's always important to keep in mind, whether we're talking about the individual human beings, you are always individual human beings, but you're also often a representative. And one of the things that governance does, it formalizes your representative, that you are a representative of an organization, not a person, right? And that's important. But the governance structure, at the very least, you have to lay out whose voices need to be at this table. That should be like the first conversation you have, even if there are only 4 of you there, and ultimately you end up having 20 partners. Who needs to be at this table? And if community isn't one of those people, you're going to go off track pretty quickly, especially with the social impact investors, who we can talk about later, who are a big potential source of long-term funding. But you also have to decide how you're going to make decisions, because you are going to disagree. It is inherent. And that's especially true when you prioritize. And so there are many different ways to make decisions, but you need to have formally agreed, we are going to do this way, so that when new people come in, they understand we take a vote, 2/3 majority, that's how we work. Or everybody gets to talk indefinitely until we have consensus. Consensus is really hard in the long term. Consensus on high, you know, what I call highfalutin things, like we want to build healthy communities. That's easy. But consensus that is 100% for something like where you're going to put money, that's much harder. And so at the very least, who's going to be at the table? What are your, you know, what are your priorities as a member of this? What are the priorities of this, the whatever it is you're representing? If you're a government, you know, the city council or whomever, and then how decision making is going to happen. Those are fundamental, and frankly, probably ought to be in writing somewhere, which is an administrative task, by the way, and speaks to why you need to understand how those administrative tasks are going to work. And I also really believe that governance can change over time, and it probably should as you get bigger, you know, as you get bigger or have more complicated interventions and that sort of stuff. You need to also think about things like, how do you make a change when an intervention's not working? Those are still governance things. If you're in the government and you've got a grant, but the whole thing is just not working, you can just say, well, we're going to stop now and give the rest of the money back. You can't do that when you're in a collaborative, as a collaborative, and unless you've made a determination of how you're going to make that decision. Does that help?
Those are really good points, really, really good fundamental points. I think we can start to launch into some of the questions and comments that are coming up from the audience, and they are really good, and keep them coming. So talk a little bit about what the non-usual suspects you think are, and how can multi-sector collaboratives really get those the non-usual folks into the room?
Yeah, that's hard. You know, one of the things I struggled with however, I started my first coalition around tuberculosis in 1998, I think, dating myself now. it was always the entities I found hardest to get to come together, to come into a collaborative was the business sector, for one. Now, most of the time I was working on straight up health type things, and it's difficult for business people to naturally see how a healthy community helps them. Some of that's getting better as the conversation around social determinants of health has started to seep outside of just the public health and healthcare world. But you still have to be able to make that case. And it's very important to have the business sector there, because some of the things that help make communities healthy are things that the business sector do. Do people have paid sick leave? Those are real, and those questions, those are the issues that are going to come up if you bring community in the conversation, and you should, and especially in prioritization. You can't make decisions about that. You can hardly influence that. But if you have business people at the table as partners who recognize that's what they are, they actually can do a lot to teach you, the other partners. If you've only ever worked in the nonprofit world, the business world is totally different, and you may or may not really understand where they're coming from. So robust, in-depth conversations have to have all of the relevant parties present. So the business sector is hard, though. You have to make your case. And that's where, figure out who in your collaborative is the most persuasive person, who's really excited, but also clear and articulate, and send them to try to get, target carefully. So Napa County is really an amazing place to work. I was the health officer here for 10 years before I went to the state. Many nonprofits, a lot of philanthropy. It's there's the wine industry in Napa makes a lot of money, and they give a lot of money. But what you want them to do is to ultimately give some of that money to your collaborative, you actually have to have them at the table too. So one of the entities that we went to and said, please come join our, Live Healthy Napa County, was the Vintners, for example. They get money from they do business for the Vintners, but they're also a philanthropy. And historically, all their money had gone to a very good cause. The one FQHC in the community, which at the time was a community clinic and not yet an FQHC. If you want to start influencing those flows of money, because that's what ultimately you need to do, then you need to have those folks at the table. And they're not necessarily the people that you ordinarily think of. So branding your collaborative, if you're a true multi-sector collaborative, is incredibly important, and what your values are. You should always have a mission and a vision, values, that sort of thing. Shouldn't speak exclusively to health unless you only want to work in health, direct health, but rather, what is that thing that you're aiming for? And how does that partner or that sector, and it's typically, there are some government sectors that are very hard to get to come to the table as well. They're just not used to partnering. And so that's one where it's a little bit easier, because you can go above the chain and ultimately get to, if the politicians think it's a really good idea, then they're more likely to be able to help you get that entity to the table. And so I think that for me, it was always the business sector was the most difficult to get to the table. And the nonprofits there were nonprofits that didn't work in health, having them understand why that they should join and help them. Also making the case. With your priorities will be part of our conversation too. Not just what I want or what, these nonprofits that what they want, but your voice needs to be heard too. Because then you will have a say in the prioritization of this collaborative.
So we're getting really good questions. I'm going to take them a little bit out of order, just so for those that have already submitted questions, you don't think I'm ignoring you. I'm just trying to keep a logical flow going. Talk a little bit, if you will, about what are some of the typical use cases for multi-sector collaboratives? the reason this question is being asked is that this person is working on a framework to use social determinants of health in clinical applications. And would this framework apply?
Okay, I'm gonna think about the last half while I'm talking about the first half. Do I think this model works? Yes, because frankly, we tend to live in our own little bubbles. Whether if you're I'm going to keep talking about public health because it's what I know. If you're in a public health department or you're a nonprofit that does public health work, you're going to talk to other public health people. You're going to make your decisions with those people. It's a very narrow way to see the world, and especially if what you want to do is create healthy, resilient communities, you have to be looking outside that world, and that includes some very unusual partners. My own personal thing is if a partner thinks that they get value out of joining, why would I keep them from joining? And so to remind me what it is, why the sector that she's creating, or the individual is creating.
It was creating, sorry, I lost my place here.
Oh, I'm sorry.
Here we go. Creating a framework to use social determinants of health in clinical applications.
Oh, okay. Well, that's a huge one. So there, yes, I mean, absolutely. You will bring power to your interventions and to selling them as something that health entities should do if you have a broad collaborative that includes multiple sectors with you, because sometimes the interventions that you need, you're trying to decide between, so let me stop, take a breath here. It's very interesting to me that right now there's a huge push to try to get healthcare delivery entities, that whether that's a health insurance plan or a hospital, to start working on social determinants of health. Now, we could argue for a long time about whether that's appropriate or not, because I personally don't think they're well set up for that, nor do I think from a general perspective, I don't think that hospitals should be trying to, get potholes fixed. I mean, there's a lot, or get better police coverage in an area where safety is an issue. However, they have a huge voice. The healthcare sector is one of the biggest, the largest entities within any community in terms of being an employer. And so if you're designing interventions for healthcare to address social determinants of health, the sweet spot is the partnerships. So interventions, you can have, interventions like, not hospice care, but recovery care, when you have somebody who's in the hospital a lot because they can't take care of themselves at home, they've just coming out of the hospital, complex medical problems. So you create a facility where those folks can go have, it's not a hospital, it's less intense, it costs less money, they can continue their recovery, they can maybe get social services in there. Well, a hospital per se by itself is going to have a lot of trouble creating something like that works. They may be able to pay an entity to build and staff that, but how are they going to get all the different partners who have to interact with that person to address their social determinants of health to come in and participate? That's something that you as a multi-sector collaborative could help with. Okay, you can say, yes, San Francisco General Hospital, or maybe UCSF, they're bigger and have more money. You want to build one of these transitional care things. Great. Partner with us. We have all these different sectors represented. Our partners include people who provide this, who can help you with that, all these different things that address social determinants of health. We're going to bring you we're a one-stop shop. All right. Pay us, and I'm using this because money really is all, I mean, you can volunteer to partner with them, which is great, but at some point you want to try to support your collaborative as well, as you mature, and that can be a service that you have to provide. So I think that this kind of being part of a collaborative when you're trying to design interventions around a specific sector is excellent, because there are almost no sectors that are independent of every other sector. It's not, humans don't work that way. We're not part of the problem, and the government does this better than anybody else, is we silo ourselves in sectors. And guess what? We're not very successful in doing things for humans, because humans are not collections of sectors. Humans have a lot of different needs that cross over, and they're all interdependent.
So really good point that somebody brought up here, and it's not really a question, but I want to just raise it as a sense to give people a sense of what kind of partnerships are required. There is a collaborative here that's mentioned in a rural community and frontier community, including family representatives, consumers, public health, social services, corrections, law enforcement, behavioral health, community action programs, and 24 school districts across 8 counties.
That's just fantastic. That is fantastic. Now that's a collaborative that really needs to start thinking hard about, how are we going to sustain this? How do we stay this and grow this? And that's wow, that's amazing, because you've got that all the major parts of the way we live and the way we build our communities are sitting at the same table and can share priorities. Everybody can stay in their own lane, as long as you are sharing your directions and your priorities and contributing to the success of everybody else.
So on that line, before we get into looking at some funding models, I want you to just talk for a moment about what collective impact model you've seen success with, and the person asking wanted to know where they could find the model.
I think so collective impact is slightly different than multi-sector collaboratives. Multi-sector collaborators inherently create collective impact. I've seen collective impact models where every single organization in the group, and they weren't technically a collaborative, but they became that over time, all came together and said, okay, we did this, the public health department did this community health initiative, or in a community health improvement plan. Let's all take that plan's priorities, the ones identified through the data, and focus on those. But we're all going to stay firmly in our own lane. I'm a mental health nonprofit provider. I'm still going to be a mental health nonprofit provider, but I'm going to focus on a little bit harder on the priority of youth suicide, because that was one of the priorities that came out of the improvement plan. And then I think about how I can do that. How within my business can I sort of shift my focus a little bit? If every partner does that, that's collective impact in its most pure form, and doesn't require formal relationships, but it requires conversations, and it can be done in small meetings, it can be done in large meetings. And that's one model that I've seen, and it works up to a point, but it depends on each individual entity's ability to stay focused on the same goal. And also, it's limited by how much impact each of those organizations can have. So nobody's doing something new necessarily. They may be shifting a little bit, but they're staying firmly in their own lane. I think the difference in a true multi-sector collaborative is the collaborative itself can do interventions that no one other entity is doing. And that's by bringing in a grant that does, something new and different, and then implementing that intervention, whatever it happens to be, that the collaborative has prioritized. And everybody in the collaborative has agreed that that's an intervention that's really important, and those that can help that intervention be successful do whatever it is that they can to do that. Maybe they get some of the money, etc. That's a slightly different model, and it allows for new interventions that are multi-sector, where a lot of it infects a lot of, you can take on a community, for example, that has several related problems, and get one pot of money to, improve lighting, bring, pay to have someone come in and teach about a specific type of safety issue. We saw a community do this. So it's a slightly different model. straight up collective impact can be done without any kind of formal collaborative governance. Well, you do have to kind of get together and agree on things. And that actually is often the start of what ultimately becomes a true collaborative. People start to like to work together. And the other thing that happens with collective impact that starts the path down to a real collaborative is working differently. When the Parks Department actually has a representative, there's a representative from a particular community that is a dearth of parks that is on the same collaborative, they're going to talk to each other more. And that Parks Department is going to get a better understanding of the community. And that community member may actually be able to help them advocate for a certain kind of park, et cetera. So just in those relationships, people can start to do work differently. When we first started a collaborative, we had never once had the planning department ever talked to the public health department about anything that they were planning. And suddenly, because we actually knew each other now, we started talking. They said, "Hey, we're thinking about doing this thing. What do you think?" You know, that's systems change. When parts of the system start working together that didn't before, you're on the path towards systems change, and that's very exciting and has tremendous potential.
So there are a couple of other questions I'm going to save more towards the end, but so that we don't use up all our time, I want to make sure that you get into some funding models. Let's talk about that for a minute.
All right. So so now I'm going to be talking about sort of mature collaboratives. So say you've gone through all those other things, you've got your governance structure down, you pretty much know how to do your administration, and you've had a few interventions that you started, that you partnered on, that worked really well. But now you have you really want to be sustainable. You'll want to make change over the long haul. You have to start looking at funding a little bit differently. Could we bring up the slide set now? Let's go to that next slide. There are two primary models that we look at. One has a really awkward name, so I'll explain it. But the two funding models that basically we've seen over the last 5 to 10 years, and they're not all in health, by the way. There are models around broadband. There are models around all sorts of other things that are beneficial to communities. So essentially, there's the fee-for-service model, and there is something called a cost rationalization intervention, which I'll explain. I don't know why it's called that. I don't know what those words mean when they're put together like that, but I'll talk about it. Fee-for-service. Let me talk about fee-for-service first. This can be the only way you get funding, but it will change. It will fundamentally change your structure. So a fee-for-service model can be a single intervention. So you're a collaborative that is interested. It's because you've got major partners are healthcare partners and health insurers. So your focus has been around health, and that's a good thing. So you're trying to do all sorts of things. One of the things that you may be able to do now, for example, I'll give you a real life example, is create. So your healthcare system is having challenges with the social determinants of health. They don't quite know how to get into that world, but they're being required to do so. You can be helpful. You can create, for example, a community health worker or promotora program, or as a collaborative. Let's say this doesn't exist yet. So as a collaborative, you want to do that. You want to create that as one of your interventions. And if you can get the health insurers, in particular the health plans, to fund that, you now have money. Now that funding can go on for a very long time if you're successful. And that is actually happening in a number of places. And some of that money can go to, especially if it's written into the contract, can go to supporting your backbone, that administrative governance, the actual structure of your multi-sector collaborative. The one thing that can happen here, though, is that may become your line of business. And suddenly you're not there's other things that you're doing, but you're doing it around the margins. Okay. So that it, or maybe you pick up another line of fee-for-service interventions, but that's one funding model. And it is often a transitional model for folks, because if you do have a fee-for-service intervention and it is successful and you can demonstrate that success, that can help you build more funding. The cost rationalization intervention model is slightly different. This is where you want to do something innovative, and that may just be your collaborative has this incredible plan to improve the community. The community's got buy-in, but there's money involved and you don't have any money. But you would have a high impact and it's a new thing. Okay. And you rationalize this cost by demonstrating the social cost of not doing what you're planning to do. Here's the situation. This is what it's costing. This is what it's costing this sector. This is what it's costing that sector. And so you're rationalizing someone giving you money to do this new thing, this collaborative process that you're going to use to improve this community by demonstrating that you are going to decrease costs. It's not necessarily, dollars that you're going to pull in and give back to somebody, but you can show where the costs currently are. If you then are successful, those costs go down. It tends to be pretty complex, but it's scalable, because if you can show with your first intervention that you can actually do this, and you can create change, and that change has decreased social cost, then you may be able to get additional money. You're much more likely to be able to get additional money. And that is one way to create a foundation for a resiliency fund, or a whatever you want to call it, a community improvement fund, et cetera. So you're sustainable through cost savings to your partners. You may earn revenue with some sort of fee-for-service type of intervention within your complex of interventions. You will then probably be able to get investment capital. Okay, and we'll talk about that in the next slide, and in particular, social impact investing. And philanthropy can play a big role too. They may want to give you a grant to continue what you're doing. They are often the first funder for non-fee-for-service interventions, these more complicated, sort of multifaceted interventions that you're going to do in a community. Let's go to the next slide. So this is a sort of a simplified graphic of how you can, over time, and with all those pieces in place, you got to have a there. You have to be trustworthy. You have to demonstrate that you can do something, and that their money is safe with you. And you can bring in multiple sorts of money. You can still get grants. You can go after fee-for-service to help support your projects. You may do a project that actually generates revenue. You may get money from the local government because they see the improvements that are happening and may want to give you money. This is creating what's called a stacked capital fund. So it's a fund that has multiple different types of money in it. And that money can come in for specific things, or it may be general money. Philanthropy is often much more general. Social impact funding is a type of investment. Many large organizations, and this means for-profit organizations as well, Ford Motor Company, et cetera, have put aside specific amounts of money for what they call social impact investment. In other words, it's money they want to give to organizations that are going to improve the society that they are working in. A member of our organization who's been doing social impact, he was a social impact investor himself. He runs funds. He builds these funds for a living. This is what he does. He says there's on the order of $60 billion a year in the United States that goes wanting in social impact funding that nobody asks for or gets. So it's a particular kind of funding. You probably need a consultant to help you figure out how to go after that and what, but the things that bring that money in is the strength of your organization. Who are you partnering with and they're active partners? What have you done that demonstrates that you can actually do something, et cetera. So that, and that you can demonstrate impact. Some social investment funds come with a small financial return, not the full amount of money they give you, but a small financial return. But more importantly, and some don't require that, it's about demonstrating impact. Okay, and that's where demonstrating impact is a little bit different than demonstrating outcome. And so actually learning how to do that is one of the pieces of maturing as a collective. And actually some government entities are pretty good at figuring out how to do that. So that's what this is an example of how this would work. So the community resilient, there's the community, which would include, for example, this might actually also be labeled your collaborative. You have a relationship with the fund. You wouldn't probably manage the fund. You'd have a fund manager. That's a very specific skill set. Now, there are some really big collaboratives that actually bring in-house that kind of fund management. But there are many different kinds of fund managers out there. That there are those that specialize in social impact funding or these kinds of stacked capital funds. That money then it goes to actually do projects in the community that the collaborative wants to do. Those are the inputs. Your data system brings evaluating impact and demonstrating outcomes. You feed that back to your organization, and that allows you to then go for more investing and more investor savings, more investment and demonstration of savings. So that's kind of at a simple level how you can create a true community resiliency fund. And it's one of the ways that organizations can become sustainable, because a part of that fund, let's go to the next slide. I think I have a diagram. Yeah, this just shows you, this is go one more slide, please. This is the kind of complicated relationship you can have. If you do have a fund, you'll need to have, there needs to be a board of directors over the fund, and that the fund itself then has a relationship with the backbone organization, right? And that then has a relationship with the service providers and down to the community benefit. And there's a constant back and forth between the investors, those who are investing in your organization, social impact or otherwise, if they're payers, they as well. It can actually create a long-term sustainable funding structure for your collaborative as well, particularly if you keep your overhead low. Then most of that money can actually go to actually doing the interventions that you want to do. Okay, you can stop the slides now. Thank you.
So I probably can see a lot of light bulbs going off in the audience here. And I'd like you to just talk a minute. There's a really good question. Why do you think social impact investing isn't drawn upon at the rate at which it is available? Can you talk a little bit about what could be done to increase the utilization from this revenue source?
There are a couple of real reasons. A lot of people don't know that it's out there, right? They know that there's philanthropy, but they don't know about social impact funding. The other, and the thing that's very different between philanthropic money and social impact money is that philanthropies are there to give money. And that's what they do. They put out money to worthy resources. They don't typically expect anything back from you, except maybe a report on what you did and how well it went. And then, you partner around, writing up the results and creating new things. There aren't any typically financial restrictions on you. Social impact investors are investors. So their money, the money that their company has put aside, is going to go out for something. Okay, so you have a relationship with that investor, just like if you're a company. If you're a company and someone puts investment into you, then there's a relationship there. And part of it may be that they expect their money back or a portion of their money back. With social impact investors, the contract is essentially, you're going to demonstrate impact. And you're going to report to me on a regular basis how it's going, what you're doing with my money, which isn't necessarily something that philanthropy does in the same way. Philanthropy tends to give grants. Grants are, you get the money in the beginning, you spend the money, and then you report out at the end. Working with investors is different. Investors often also want to have a voice. Now, typically, that can be a voice either at the fund level, or they may actually want to have a voice if they're a local social impact investor within the organization itself on like what priorities are set. Now, that's one of the reasons that you need to have a strong documented governance structure, because it's great to have their voice. But not if they're going to dominate because they think it's their money. Because once they give it to you, it's not their money anymore. It's an investment in you, in your organization. And so it's a negotiation when you're working with investors. And I will tell you, I have not personally done this, so everything I say is very high level. And if you want to get into the weeds, there are other sources and other people you can talk to about that. I think the most important thing typically in the conversation with social impact investors is, what impact are they looking for? What you do typically is you do a presentation, you tell them what you want to do, and then you have a conversation about what is the realistic expectation, what it's going to cost to do that. Do you have other sources of funding? Typically, social impact investors want to give to organizations that already have a foundation and where they can just push over for a particular type of intervention. Usually in the cases that I've seen, and my experience here is not really nationwide extensive, it tends to be philanthropy that puts the original first set of money in for you to really develop your organization and your interventions, and then maybe you get a fee for service something or one of your organizations does and is partner enough to say, we're going to use this, we're going to claim this as work that we did as an organization. Then is when you can start talking to investors, because investors, they tend to have a target for their investment. It's not just any good works. And so a big part of the challenge in the world of social impact investing is meeting the right investors. And there are ways to do that, but it requires consultants. So you have to get to a point where, unless you've got somebody, if you've got somebody, there's another reason for having some of the big players in your community at the table. And I'm talking private sector, because they're the ones with those contacts and they know where that money can be. There are also entire financial organizations that are what are called donor advised funds platforms. So those are financial companies that that advise donors, usually social impact donors, on how they should invest their money, and they hold that money for them and look for those investments. So it's a world that I'm not very familiar with. I'm way more comfortable in the collaborative governance, decision-making kind of thing, but I've seen it work, and it can in fact create a really robust financial resource for sustainability, for sustaining your collaborative. It's not like you're not going to be, you inevitably need to find multiple types of capital. You're still going to go after grants, but what you want to try to do is pick grants so that you don't apply for 6 grants that are all going to end at exactly the same moment. So it gives you having a base of funding, whether it's from philanthropy or social impact, gives you flexibility to go after grants, but you want to try to stagger them so that the ends and new ones starting are overlapping, so that it's kind of like you don't put your paycheck in and go out. Well, if you're lucky, and I've been very lucky and privileged, I don't spend my whole paycheck the minute I get it, because I don't have to, because I keep a certain amount of money in the bank to cover the gaps. And it's a lot like that. It's just the sources of money are much bigger and more complicated, frankly.
So a lot of real estate is being covered here in what you're talking about. And I want to kind of get back for a moment to a couple of the governance questions just really quickly. We've got about 15 minutes left, and the questions from folks have been really good and really stimulating to this conversation. But back onto governance. Have you seen private sector companies as the lead anchor or administrative lead on a collaboration?
If by private sector you mean for profit,
I think so.
no, I have not. That doesn't mean it can't be done.
Yeah.
But usually for-profit entities want to make a profit. And their business may not be something that, or maybe it is, I could envision that if you had a nonprofit health care type, some sort of health thing, provider that wanted to really, sort of engage in social determinants of health, there's no reason they couldn't be the anchor organization. But ultimately, I'm a huge believer that your collaborative should become an organization itself. That's a personal belief, and it's not universal. I've seen it work really well without that happening, but it gives you so much more flexibility. Social impact investors much more likely to invest in you if you're, say, a 501c3, for example, because you have that. In order to be that, you have to have that organizational structure, the administrative capabilities, and a governance structure. You won't get your 501c3. So you become an organization, and if you're an organization, you're less likely to fall apart if one or the other partner, disappears for some reason. They lost their funding, they, get mad at somebody, who knows. But you have to build to there. I mean, we were looking toward that in Napa. We had a big collaborative, Live Healthy Napa County, and we had this big portfolio of interventions, which every entity just put in everything that they were doing. That's a first step, and that's great, and it was working, and it's still working. But in terms of creating new interventions, they haven't really been able to get there. They've been able to change the way the system works, which is incredible. If you do nothing else, system change is the goal. And they have also elevated community voice and the need to prioritize community in a way that's actually changed the way the city council works, for example. And so I'm not saying you have to become an organization and get a resiliency fund in order to be worthy and to have do and to continue to do really important work, but it sure helps to have money. And to have money, getting money in the long term typically requires some sort of a formal organization.
So I think you just touched on this with your last answer, but I want to bring the question up anyway. I think this is a very good one. What do you think is the root cause for the need for multi-sector collaboratives in America? Should we be sustaining multi-sector collaboratives, or should we be focused on systems redesign in ways that are more integrated at baseline?
Well, I don't know how you become more integrated at baseline if you don't have a collaborative talking to each other. So I don't honestly care whether you become something that you call a multi-sector collaborative. If you can successfully redesign a system and include all the different partners without actually bringing them together, that would be hard. And I don't think that they're actually fundamentally different. I don't know how you get to redesigning a system from the get-go. In real life, in a perfect world, you could do that. But our problem, the biggest challenge I see to real systems change is the degree of siloing that we have. Everybody, and it all stems, unfortunately, at least in government, back to money. because nobody wants to fund these fuzzy things. We were going to go out and create health in community and do whatever it takes to do that. Nobody's going to give you money to do that. Health departments forget, for example, that's the world I know best. Even the California Department of Public Health, almost $4 billion budget, 221 programs, almost every single penny, less than 1% of the money was flexible. It all came with a very explicit requirement to be used to do a very explicit thing. And that's how most of government works. If we could redesign that, I'd be thrilled. And redesign a system so that you were forced to work together. And that's the other way that it does happen. You know, sometimes leaders will force different entities to work together. But we're pretty concretized, if you will. That's my word for it. I mean, it's going to be hard to bust the silos unless you bring people together and get the people who really want to bust the silos working together.
Truer words were never said. I want to end with this question. It's one of the first comments that was made earlier, and I think it's a really good one to bring up now to kind of close us out. What are promising practices around navigating financial sustainability in ways that are equity forward? Many of the more sustainable, like a non-government, non-grant funding sources, are plagued by systems of oppression that make them focus on delivering system-defined return on investment rather than being accountable to community-defined impact measures.
Right. Well, this is where social impact funding comes in, because it typically is not as rigid. And if you did just one thing, it's making sure that you have legitimate community, not the usual voices necessarily, but real community input and fidelity to the priorities of the community. Like, I can come in thinking I know exactly what that community needs. That is not going to, and I can go out to get money to do exactly that thing. That is very unlikely to redress in any way, shape, or form the built-in inequities in our systems. But you bring everybody to the table, and you bring the people who live, work, and play in that community together to talk about what their priorities are, and you have fidelity to that. You will find investors who want to bust apart. Most social impact investors are not focused on a single thing. They are focused on strengthening communities. Because, I mean, in part, you know, we've had a horrible series of natural disasters, if you will, not just in the United States, but around the world. I mean, it's sort of mind-boggling. And what that has done is demonstrated to absolutely everybody the cost, even if you only think money. I mean, even if you're like the world's worst capitalist, you know, and all you're thinking about is money, the cost of these disasters is extraordinary. Building resilience. And so I like to talk about healthy, equitable, and resilient communities. Building resilience inherently requires equity. You cannot build resilience in an inequitable space, because there's always somebody at the bottom who is going to be the most impacted. So focusing on equity, focusing on sustainability and resilience in communities, and honoring and centering community voice will change things, especially at the local level. It's very hard to change a state government or a federal government. It's remarkably easier, I won't say it's easy necessarily, to influence your local politicians. The space between you and them is like that big compared to like this. And if you can sway them, that will change how they budget. That will change then that community, which will then roll up to, you know, that's how you make systems change from my perspective. Because I'm thinking my limited lifetime is starting at the local level and watching it ripple from there. And if you do that in enough places, that change starts to be visible outside of the sectors that you're working with. And there's this sudden, aha, oh, look, hey, that's cool. Look how much money they saved. That's usually the one that gets people's attention, frankly, in America anyway.
Yeah, the truer, like again, another truer word was never spoken. So we've got a couple of minutes left. And I just want to ask you, you've made a really, I think in your own life, such a major shift, 180 degrees almost from going to very structured government, defined every outcome, every work process defined and every program siloed. You've made a big change in where you're going. And I wonder if you could really help us as an audience think about some opportunities to maybe take the work that we're doing, which may be very well defined and may be very siloed. How can we be more impactful in the work that we're doing going forward, given what you've learned, making that change yourself?
Yeah. I think the main thing I learned from government is it's tremendously powerful, but not nearly as much as people think when it comes to making change. Because government's inherently large and complicated and restricted, especially in America, because you're spending the taxpayers' money, and people feel really strongly about it. The reason I changed was what I saw. The most impressive, most exciting change that I've seen has been when community comes together. And the first times I saw that were actually during disasters. But it turns out you don't need a disaster. You just need a really cool idea or somebody with a lot of enthusiasm to bring people together. And it's nice to have a vision of shooting for the moon, but the reality is you can do a lot by starting small and being successful and being excited about that success, because other people will do it too. So I moved. So working in government was great because my goal was always, how can I make this work better for people, for humans? But it's incredibly restrictive. So now it's like, what I saw work was people working together with people for a shared goal. And I am so horrified by the degree to which racism and other inequities are built into our structures, but I do not believe for a moment that government can change that. They can do around the edges, but I do believe that people can. And I believe that it starts at the local level. And that's why I'm doing what I'm doing now, which is talking about how do we do this? How do we use that potential of collective impact to build change from the ground up, because that's where the inequity really is at the ground level.
Well, I really want to thank you. This was a really great structured conversation about how to think about the work that we do from a slightly different point of view, in a way that could maybe help people to think in a long-term, sustainable, grounded, community-centered approach. We all do this work because we believe so strongly in it, and the place where the money is not there.
Right.
And so trying to find ways to get to where our goals and where our purpose is really aimed, it's really good to have a conversation like this and really think in a structured way about how to get there. So thank you so much for this. And I'm hoping the audience got a lot out of this. I want to go ahead and close us out because we only have about a minute left. I think we have a closing slide. Okay, just reminding everybody that we do have an Acting for Public Health Challenges and Opportunities in legislatures and the courts. That'll be a Dialogue for Health presentation on Wednesday, September 27th. Please log in and get on the mailing list for Dialogue for Health. We do so many programs that are of broad interest, and we really thrive on hearing from you. What was important about this particular session? What do you want to hear next? Help us set the kind of agenda for these broadcasts that really matter. There's a lot of knowledge out there. We want to make sure that the knowledge gets to this table, that we can have conversations and we can learn from them and do even better work going forward. So thank you so much to everybody for joining, and we will see you next time. Goodbye.